Okay. So far we have finished 4 branches to my knowledge. We have finished the ABO grouping. Then we have finished estimation. Then we have finished HP estimation. Do we done any other test apart from them? Only these 3 so far. Okay. Listen. So yesterday I have discussed one more interesting topic, that is ABO grouping 2 types. What are those? Forward grouping and reverse grouping. What is the purpose of reverse grouping?
To test for antibodies.
Yes.
To test for antibodies.
To detect antibodies in the blood. Okay. To be precise, to detect any abnormal antibodies that are targeting donor cells. Okay. To detect any abnormal antibodies, we are doing reverse grouping. So, what reagent we are taking in reverse grouping? Reagent we are taking in reverse grouping.
Serum.
Okay, tell me, what we are taking from the patient? What sample we are collecting from patient?
Serum.
Very good. And what reagent we are using to detect the groups of patient? In case of forward grouping, we are taking blood sample and we are adding reagent. That reagent we have anti-sera A, B and RH anti-seras. Am I correct?
Yes, yes.
Similarly, what reagent we are using in reverse grouping?
Patient serum and donor cells.
Yes? Very good, Miss Simran. Well done. Everyone appreciate Simran. This is total observation. All of you are simply, listening, that's it, without assimilating. Anyway, we are taking known blood cells. Okay, known blood cells will be taken here. All RBCs are taken in reverse grouping. Known A group, known B group and known positive group. Okay, that's it. Actually, RH typing is not required in reverse grouping. Okay, very good. So this is all about ABO grouping. What is the significance of ABO grouping? For transfusion and related. Is it only for transfusion? Only for transfusion we are taking ABO grouping, or is there any other purpose apart from transfusion? Apart from transfusion, is there any other purpose of ABO grouping? Any idea? Yes? See? Yes? Erythroblastosis fetus. Maybe for mother we are doing cross matching in the mother. That is a different topic. Any other purpose? Research. Immunity. What you say? Listen, I think you don't know this one. For checking the parents, okay, the identity of parents of the children, okay, we will take the mother's grouping, father grouping, and we will do Punnett square test. Simply, we will get the derivation of 50-50% ratios. So, even parental testing can be done by ABO grouping. Very interesting thing. And yeah, those are some things. For forensic purpose, you got a crime scene, you need to cross check the blood group. So, for forensic purpose, we can do blood group. Yeah. Then, can you recall what is the major cross matching? What is major cross matching? Can you recall?
Patient serum to donor cells.
Donor cells mixed with
Patient serum.
recipient serum. Very good. Excellent, Miss Melissa, right?
Yes.
Well done, Melissa and Simran. Very good. Yeah. If you don't know what is cross matching, you should know. You are on leave, right? Yesterday. Anyway. Next one, ESR. What is the purpose of ESR?
To check inflammation.
Inflammation. Very good. So, conditions of inflammation. Any 2 to 3 conditions? Very good. Rheumatoid arthritis, rheumatoid factor, Joint pain. These two are joint pains, by the way. Then pregnancy. Okay. There is one infection. Tuberculosis. So this is a non-specific test for identification of inflammation. That is ESR. Methods of ESR. Ring-probes and Western lens method. Very good. What is the length of Western lens tube?
30 centimeters.
30 centimeters. Length of windows?
15 centimeters.
Okay, 15 centimeters, but the graduation will be 0 to 11. 11 centimeter. Actually, if you see the glass rod, the size is 15 centimeters, but the graduations will be 0 to 11. Okay. Anyway. Then next one. What anticoagulant we are using for ESR studies? Very good. These are some important points. Then value in males and females in Western wings. Males and females in Western wings. 5 to 15 and per hour. And this one?
5 to 20.
It will be more than this males. So 10 to 20 mm per hour. Right? More greater than males value for females. That's it. Then how about up to 30 also we know, right? This one? Yes, I know. Alright. 15 to 30 or 10 to 30. Next one. 5 to 30. Okay. Then windows. Males. 0 to 5 in males. 0 to 8 in females. Very good. These are the normal values of ESR. Very good. We are coming to the HB. So methods of HB estimation. Yes. Yes, colorimetric method. Colorimetric. Cyano with hemoglobin method. Then automated method. Charlie's method. So in this Charlie's method, we are taking a reagent. What reagent we are taking in Charlie's method? Very good. M/10 HCl. If you ask the percentage of normality of M/10 HCl, then it is 1%. 1% normal HCl. Very good. 0.1% normal HCl or M/10 HCl. Very good. What is the principle of Charlie's method? Principle of Charlie's method. HB plus M/10 HCl leading to acid chromatin formation. This acid chromatin is brown color complex. This brown color complex will be compared with standard or comparator. Right? Very good. So what are the apparatus we used in HB estimation in the Charlie's method? HB stand. We have a stand. Then HB pipette. What is the purpose of this pipette? To color the blood. How much quantity of blood? 20 microliters of blood. Very good. And we have HB tube. What is the lower graduation mark in HB tube? 2. So what is the purpose of this one? We are collecting acid up to 2 marks, right? Then upper graduation will be up to 22 grams. Up to 22. Then you will start adding drop by drop distilled water and you will cross check the color. Once it is achieving same color, you will take the reading. This is all about the HB. What is the normal HB values in males? Males normal HB values. 11 was previous times. Now the minimum quantity is 12 grams. Keep in mind, okay? So for males that is around 13 to 17 grams per deciliter. This is for males, and for females this is around 12 to 16 also. 15 also fine, okay? Grams per deciliter. Listen, internationally they say even 11.5 is a anemic status for women. So So yeah, they are very stringent about HB values because HB is one significant what is that? Significant parameter for anemic status. Okay, indicator for anemic status. Very good. If the HB is less than the normal value, that anemia is called as. If HB is less than normal value, it is called as
hypochromic
very good. Hypochromic anemia. Very good. If HB is greater than expected value, hyperchromic anemia. Hyperchromic anemia. Both are dangerous. Can you give any two conditions of hypochromic anemia? Any two factors leading to hypochromic anemia?
iron deficiency.
Very good. Iron deficiency. Then any other? Malaria. Very good. Yes. And pregnancy. In pregnancy, there is a tendency of anemia, and anyway, we will compensate it with folic acid supplementation and vitamin B12 supplementation. Very good. See, there is a concept called reinforcement learning. Reinforcement means simple. Every day you should recall what you did yesterday, and that is how you can keep tight bonds of what you done. So if I am taking everyday revision, don't mind. This is the best practices to reinforcing on memories, academically speaking. Anyway, by non-academically, I will learn one more interesting thing. Since I said reinforced learning, did you anytime question yourself regarding why we get dreams? What is the purpose of dreams? What is the reason? It's a brain mechanism of reinforcing what you saw the day. Okay, it will keep on recalling, and that's how the brain functions. So yes, this is our biological activity, and bypassing or revising is one of the mandatory protocol because that is how we are biologically programmed. And dreams is one of the example. Okay, I'm telling really, I'm not making it up. Dreams is one example of reinforced learning, natural reinforcement. Anyway, then today's topic is thin blood smear preparation. Okay, so what is the purpose of thin smear preparation? What do you mean by thin smear preparation? Have you prepared thin smear by the way so far? You have done, right? Yes. What is the purpose?
To observe cells
To check the morphology. Okay, listen. Blood smear I'm writing here. Take notes. Blood smear. This is your 7th practical final. One of the practical. So blood smear. So the purpose of blood smear is to check the cells. To check cell morphology. To check the cell morphology, then to check cell size, to check cell complexity. When I say complexity, that can be also granularity. Then to count the cells, then any other purpose you can add here? Purpose of making a thin smear or blood smear. If you go more there, to stain the cells, you cannot stain with a blood, right? So you need to make a smear. So to stain the cells, then other one, to check blood parasites. To check blood parasites, to check the presence of blood parasites. Any other thing you can add here? Purpose of blood smear preparation. Any other points? And to preserve the cell abnormalities or morphologies for preservation purpose. Okay. When I say preservation, I was trying to say that today one patient has leukemia, a blood cancer, and definitely they will have some specific abnormal cancer white blood cells. So I made a smear, and this smear can be preserved because this cancer treatment will go for next 6 months. After 6 months, I will take his smear again and I will cross check with the before smear with after treatment smear. So before smear is just a preserved smear. So that means we can also do preservation of blood cells by preparing smears. That is the idea. Okay. Yes. You want to add anything, Ms. Srishtika? Somehow you are connecting, sir. On anyway. So any other point you want to add? Yes, Manpreet. Yes, Arpita. Yes, Melissa. Okay. Now listen. So there are broadly two types of blood smears. Okay. What are those? Can you tell me? Very good. Thin and thick. So what is the difference between thin and thick? Tell me, students, simply. Thin blood smear means what and thick means what? Yes. Thin means very pale, very slight layer of okay, transparent layer can be stated as thin layer, but there is one term this one. Sometimes off tracking. Anyway, listen. Simply there is a technical word that is monolayer. Single layer. Single layer of cells. We have to achieve single layer of cells. That is called as thin smear. Single layer. If more than one layer present, that is called as thick smear. Greater than one layer. Greater than one layer will be thick blood smear. Okay. Now listen. Our blood cells are very small, very tiny. I already given you an analogy. This dot has 5 million red blood cells. That means they are very small, right? So, what is the ideal smear for counting the small cells? Multi-layer or single layer? Single layer. Why not multi-layer? Multi-layer is best thing to study the cells. Why? Why Abhishek take this multi-layer? Oh, Abhishek giving more technical terms. He said thick is quantitative. Right. Quantitative, and here he said qualitative. Please define in your own way. What do you mean by qualitative?
In this particular case, you can change the morphology and size as compared more efficient as compared to the case of
here we can check more efficiently compared to this. You are trying to say. He might have a point. That's why he went with qualitative. Simply the definition of qualitative is either presence or absence of something is qualitative. And quantitative means to quantify the count. If it is something present, how much it is present. That is called quantitative. Now listen, Abhishek came with one logical approach, but that is wrong in this case. The thing is, if you are trying to count something and the counting is in double layers, imagine. This is the depth, okay, top portion, and this is bottom portion. Now you have double layer. You will get a false results. You are counting multiple cells. It's not a mono layer. So we can't count cells in a multi-layered smear. That is thick smear. That is not possible. You go with thick smear. In thick smear, why you thought only qualitative? Why not quantitative? We can count the cells in a mono layer. Why you bothered about multi-layer? It's not required. Multi-layer is not good for cell counting. Cell counting is always good at thin layer or mono layer. Got it? Multi-layer. Imagine you have two cells and both the cells are stained. Now you can't see anything. If it is single cell, there will be proper light passage through microscope and you can see the cell clearly. So thin smear is always good for cell counting. So I am writing here, cell counting. How many cells we can count in thin smear? Tell me. How many cells, I mean how many different types of cells we can count in thin smear?
Red blood cells.
Are they even this you are thinking?
Red blood cells.
Taking time. Okay. Red blood cells, we can count red blood cells, we can count platelets, and we can also count white blood cells. Now, in the white blood cells, if you are going to count individual white blood cells, then that is called as differential leukocyte count. In DLC, you are going to count both granulocytes and agranulocytes. Tell me the types of granulocytes now.
Neutrophils.
Yeah.
Eosinophils.
Neutrophils, eosinophils and basophils. Then agranulocytes, monocytes and lymphocytes. Up to here is clear. I was happy with your answers. But now I am getting challenged with you. That is the morphologies of individual white blood cells. What is the morphology of neutrophil?
Bilobes.
What?
Bilobes.
Multi-lobe. Multi-lobe. Very good. And what granules are present in neutrophil? See?
They are dark.
Ah, very good. Very, very good. Listen. Very good. Listen. White blood cells has two types of granules. Either the granule has acidic in nature or the granules are basic in nature. Okay? Acidic granules will take there is a logic, I will let you know. So imagine this is the nucleus and this is the cytoplasm of a cell. Okay? We are going to use, so nucleus is acidic in nature and cytoplasm is basic in nature. But now in the cytoplasm we have acidic granules also. Acidic granules and basic granules. Okay? Acidic granules will be in pink color. And basic granules, I was telling you, this is why I was saying that. Acidic granules will be in blue color and basic granules will be in pink color. Is it true? Like,
Yes.
let me cross check. 1 second, wait. DLC. You know why I am confusing? Because there is something called Leishman stain. In Leishman stain, we have two types, that is hematoxylin and another one is eosin. Hematoxylin is a basic dye that will dye the acidic part of the cell,
Yes.
whereas eosin is a acidic dye that will bind to the basic part of the cell. So that means the basic part, that is pink color, will be in basophils, basic things will be in pink, and acidic will be in color. Anyway, listen. The concept is, why I am telling this, I will let you know. Imagine if cell has 50 base and 50 acids, 50 protons and 50 electrons in a single cell. What will be the overall net charge?
Neutral.
Neutral. There should be one deficient to become either an anion or cation. Correct? To get either negative charge or positive charge. Since it has balanced both acidic and basic granules, the overall charge is 0. That is why the neutrophil is called as neutrophil, because it has both acidic granules and basic granules, both blue color granules and pink color granules. Simply, that is why it is called as neutrophil, and that is how we can identify neutrophil. Now you understand right why I connected?
Yes, sir.
Yeah. Now, coming to the eosinophil. Okay. These cells are taking pink color substance when we are doing Leishman stain. Okay. Pink color. What is the dye name of pink color? Eosin. And now you understood that why these cells are named as eosin? Because they are taking eosin dye. That is why these cells are called as eosinophils, eosinophils. Now today you got the point, right? Eosinophils. Eosinophil nucleus is in
Biology.
bilobe. So what is the color of eosinophils? Pink color. So the granules are pink color. That is the eosinophil morphology. Okay. Next final one. Here, this is a basic pH. Okay. These cells are taking only basic dye. What is the basic dye we have? Basic dye is hematoxylin, and that is why these cells are called as basophils. Blue color granules presenting basophils. That is why these cells are called as basophils. That means entire white blood cells are named by the stain we used. That is Leishman stain. The concept of Leishman stain is acidity actually. Acidic dye and basic dye, and how they are staining. Anyway. Coming to the monocytes and lymphocytes. Monocytes has a very large circular nucleus, whereas lymphocytes are comparatively smaller, and they have I made a mistake. Monocyte has a bean-shaped nucleus, kidney-shaped nucleus in the monocyte, whereas in the lymphocytes, a crescent moon-shaped cytoplasm can be seen. Crescent moon shape is the nucleus was almost occupied the cell, and some portion of cytoplasm is visible like a crescent moon. Crescent moon. That is why that is the identification feature of lymphocytes. And there are two types, small and large. Small lymphocytes and large lymphocytes. These are the cells of blood. Right. All these things can be detected by a simple blood smear. Thin blood smear. Is it clear? Very good. Then next one is thick blood smear. What is the purpose of thick blood smear? Any idea? This is not for counting cells. Then what? Then what is the purpose? Very good. For detection of blood parasites. Blood parasites will be detected in thick smear. Okay. Now can you name any 2 blood parasites or 5 blood parasites? Malaria. Malaria is not a parasite. It's a disease. Tell me the malaria parasite name. Very good. Plasmodium falciparum, Plasmodium ovale, Plasmodium malariae, Plasmodium vivax, and the Leishmania species. Leishmania species. Negliria, Leishmania multiple. Okay, these are the parasites we will detect in thick smear. Okay. Is everything clear so far? Yes. P. malariae. P. malariae, P. vivax. P stands for Plasmodium. What? P. falciparum. 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 P. falciparum. P. ovale. P. malariae. P. vivax. And Leishmania species. Leishmania we have multiple species. Leishmania donovani, Leishmania brucei. There are multiple species. Anyway. Yeah. Clear? So now, last time, I think Mr. Shrishti or Muskan, they faced a technical challenge. The challenge was, I said don't do mouth pipetting for HB pipette, and I instructed you to squeeze the pipe to draw the blood into the HB pipette. And now once you started, theoretically that is easy, but once you started, practically that is very tough. So practical skills are very important apart from theoretical. So the same thing applies for thin smear also. You will think that take a slide, take another slide, you just do like this, you will get things clear. Not at all possible. It takes an experienced lab technician, at least 6 to 1 year, 6 months to 1 year, to get a proper tongue smear. If you are not getting a tongue smear, you will give a false positive results. You can't see the cells properly. They will be overstrained. They will be multi-layered. So thin smear is one of the important lab tests. It deserves a separate test itself, not even staining, just to make a smear. That is one skill. There are two skills a lab technician should have. First skill to collect the venous blood, and second skill to make a blood smear. If you know these two, you can survive anywhere in this world. Got it? You just imagine a situation, you got a job and your first role was to draw blood and you started shivering there. That's it. That is your final day of your job. So yes, these two are important skills. Okay. Now let us see how to make a thin smear. First you will take a slide. Okay. An ideal good standard thin smear should have the following things. Listen, you kept a drop of blood. Okay. Then you spreaded it. After spreading, you will get like this. Okay. Like tongue of Kalima, like a tongue. Okay, for example, don't take it personally. Now this has a three areas. Oh, they didn't understand what I said. They say God and the tongue outside. Okay. Head, body, and tail. Even in tail, the ideal location to check the cells will be at the periphery. This periphery has one word, I forgot that word, something called a fragmented, some word similar to fragmented. Yes, bicycle. Bicycle has many jokes there, I guess. You should smile now.
Sir, I'm learning.
Oh, you're learning, no issues. Okay, that you can. Yeah. So very simple. Thick, slightly thick, now thick. We thought this is a thin smear. Even the thin smear has portions. Okay. By the way, I want to tell another interesting fact about India. Okay. If you see the Indian geography, maybe this is the Kashmir and all. This is Gujarat. So this is India. This is Arunachal. Okay. What I was trying to say here is, do you know one interesting fact? The Himalayas are very top to the sea level. They will say sea level. So this is very top, maybe sea level 5,000, and Kanyakumari might be 10 meters of sea level. Have you thought about the values? That means India is like a giant staircase. The staircase is, it's spread across the nation. Okay, that means India itself is a very big sphere. You got my point. So this is head, body and tail. Exactly. This is low sea level and this is the highest sea level. From here you will see many elevations from Shimla onwards, right? Himachal. Yeah. Yes. Just to remember, I said this, don't take it as granted, but this is true. Coming to the sphere. Head, body and tail. And even in tail, this is the ideal location to check the cells. Now, what possible mistakes you will do leading to an error report? Let us assume the room has so much dust or the slide has many dust particles. What happens now? You will interpret dust particles as strained particles and you will count them as cells. So that is why the slide should not have any dust particles. Rule number 1. No dust particles. No dust particles. Rule number 2. When you are making a smear, you did a rap dance, wrapping there, and what happened? Now there are some air spaces, air bubbles. Now these air bubbles looks like a cells. So that is why no air bubbles must be present. No air bubbles should be present. Then third rule. ensure that this slide don't have any oily materials. Why I said oily materials? Because when we are reusing the slide, sometimes these slides might be used for oil immersion, 100x, where we used a cigar wood oil. Then what we did, we took one slide, we wiped it with a cotton, thinking that it is a clean slide. Visually it looks clean, but it has a thin layer of oil. Now that oil smudges, looks like a cells again. That is why no oil or greasy smear. Ensure that it is a dry smear, not a greasy slide. I can say slide. Okay. Yes, you have any joke? So you simply, for this simple thing, you are taking 2 hours lecture. This is a plurality, I can speak. Anyway, I will take my lecture. Yes, where am I? Greasy smear. Smear should not be grease. And any other things you want to add here? Yeah, I will add. Listen. Yes, Arpita. No, oh. I thought she has a point. Listen. How to make a smear? Very simple. You will take another glass slide. The glass slide you are using for spreading. This is called as spreader. Very good. Spreader. And this is the slide. Okay. Now, how to do smearing? I will let you know. The angle of spreader. The angle of spreader matters. Maybe angle, I will give one best example if you can't understand. If you want to cut a pencil with a knife, are you going to cut it like this? You can't. Okay? This is higher angle. What is the ideal angle? You will keep it this and you will go upright. So there is some angle like this. So there is an ideal angle to split the smear. That angle, an ideal angle should have 45 degrees. That's it. An ideal angle should have 45 degrees. Okay? The higher the angle, the thicker the smear. This is the rule. The higher the angle, directly proportional to the thickness of the smear. If angle is more, imagine there is a water here and I used a duster, okay, and I touched the water and I did like this, vertically. So most of the water will be spread very thinly. If I use a slant, what is this? Pucha, what is that? Mop, okay. Mop will be in an angle and mop will spread even large area. That means it became a thick sphere. Okay. So if you increase the angle, the thinner it is. Ideally the angle should be 45 degree centigrade. Okay, very good. Last and final, steps of preparation. Very simple. First you will take a slide, ensure that is dry. Do one simple thing. Wipe the slide with a alcohol. Why alcohol? Alcohol is a lipid soluble. So if it has any oily smudges, that can be removed by spirit. Spirit has alcohol. Okay, ensure this is a clean, dry smear, dry slide. Now add a drop of blood here. Add a drop of blood. Now listen, very important step. Ensure that your spreader, how to draw spreader, let it be a 3D slide. This is 3D. Yeah. Oh, now I become artistic. Now see. Yeah. See. Ensure that the spreader don't have any nicks and ticks. What do I mean by nicks and ticks? The edge should not be rough. It should be an even edge. The spreader edge should be smooth and even. It should not have any rough edges. Clear? Yeah. Next one. Keep the spreader in front of the blood. Okay. Now slowly bring back, maintaining your angle. Maintain your 45 degree angle and slowly bring back the spreader. Once you get in contact with the blood, what happens? Now the blood will spread to the entire spreader like this. That is because capillary action. The fluids will spread. Okay. Now the blood has been spreaded. Immediately once it is evenly spreaded, now give a forward quick stroke like this. A forward stroke. That's it. Technically, you should end up with a tongue smear. If you didn't get a tongue smear, what might be the reasons? Dust, air bubbles, wheezing, lack of proper angle, leading to no tongue smear preparing. Okay. Yeah. So that is all about thin smear preparation. Any doubts? So on the board there won't be doubts, but once you are doing, you will get challenges. And today we will practice this smear preparation, and we will check red blood cells. Okay? You can clearly check red blood cells without any stain, because already cells are in red color. So beautifully you will see many red blood cells. They are really beautiful. So today we will perform thin smear preparation. Any doubts in this test? Nothing, right? Then get ready for the test. Yes. Take your mobiles. Abhishek, arrange this one. Where is